Welcome back to our channel. In today's video, we'll be discussing the nature of drugs in depth. So let's get started. Have you ever wondered what makes a drug effective? Or why some medicines come in tablets while others are injections? Well, understanding the nature of drugs gives us the answers. So, let's explore their properties, sources, and how they interact with our bodies. A drug can be defined as any chemical substance or product that is used or intended to be used to modify or to explore physiological systems or pathological states for the benefit of recipient. You may have heard of drugs in the context of medicine, treatment, or even recreation. Drugs come in various forms like pills, powders, liquids, injections, and even gases. So what exactly do we mean when we talk about the nature of drugs? Well, the nature of drugs refers to their fundamental characteristics, everything from their chemical composition to their biological effects and mechanisms of action. Drugs can be classified based on various factors such as origin, chemical structure, solubility, and physiological effects. They range from synthetic compounds created in laboratories to natural substances derived from plants, animals, and minerals. So let's start with chemical nature of drugs. When we talk about the chemical nature of drugs, we're referring to the chemical composition and the structure that defines how a drug behaves in our body. Essentially, it's all about the molecular building blocks that make up the drug and how these molecules interact with biological systems. Every drug has a specific chemical structure which determines how it interacts with the body. These structures are made up of atoms like carbon, hydrogen, oxygen, and nitrogen, and their arrangement forms the drug's properties, its effectiveness, how it's absorbed, and how long it lasts in your system. Now, why does this matter? Because the chemical nature of a drug influences its solubility, absorption, and mechanism of action in the body. Drugs can be broadly classified into two categories. First, let's talk about organic drugs. These are drugs that are primarily made up of carbon-based compounds. They are often derived from natural sources, such as plants, microorganisms, animals, and synthetic sources. On the other hand, inorganic drugs do not primarily contain carbon. Instead, they are derived from minerals, metals, and simple inorganic compounds. Now, some organic drugs are weak acids, while others are weak bases. Let's look at a few examples. Aspirin, or acetyl salicylic acid, is a weak acid and best absorbed in the acidic environment of the stomach. But morphine, it is a weak base, better absorbed in the intestines, where the pH is higher. Since organic drugs are mostly weak acids or weak bases, their absorption depends on the pH of the body fluids. Acidic drugs are absorbed better in acidic environments, while basic drugs are absorbed in alkaline environments. In contrast, acidity and basicity of inorganic drugs is more distinct, as they exist in stronger acid or base forms compared to organic drugs. For example, acidic inorganic drugs such as aluminium chloride, which is used as an astringent and antiseptic, and basic inorganic drugs such as magnesium hydroxide. It is a strong base commonly used as an antacid. Unlike organic drugs, many inorganic drugs act directly by neutralizing acids or bases in the body, helping to restore pH balance. Next is solubility. The solubility of organic drugs depends on their polarity and functional groups. They are more soluble in organic solvents like alcohol and lipids. However, water-soluble organic threads also there, like caffeine. In case of inorganic drugs, they are typically salts, metals, or mineral-based compounds, and they are dissolved easily in water. Now let's see how these drugs work. Organic drugs are carbon-based compounds that typically interact with the body's biological systems in one of these ways. They work by interacting with receptors, enzymes, or proteins. For example, Alkaloids like morphine. They are used for pain relief. Steroids like hydrocortisone are anti-inflammatory drugs. Glycosides like digoxin are used to treat heart conditions, and proteins like insulin are used to treat diabetes. Inorganic drugs, on the other hand, work by altering ion balance, neutralizing acids or supplying essential minerals, or even by forming complexes. Examples include aluminium chloride, which is used as an astringent and antiseptic. Apart from these, iron supplements for anemia and lithium carbonate, which is used in treating bipolar disorder. The next important aspect is the physical nature of drugs. Not all drugs come in the same form. But why does this matter? The physical nature of a drug plays a crucial role in how it is absorbed, distributed, and ultimately works in the body. Based on the physical nature of drugs, drugs are classified in different forms, such as solid form, liquid form, and gaseous form. So first one is solid form. Solid drug formulations are the most commonly used dosage forms due to their stability, ease of storage, and accurate dosing. These drugs exist in solid form and are typically formulated as tablets, capsules, powders, or granules for oral, topical, or even injectable use. Solid drugs offer many advantages over liquid formulations, like longer shelf life and stability, precise dosing with minimal risk of spillage or wastage, easy storage and transport, and taste masking. Now let's see what the different solid dosage forms are. The first one is tablets. Tablets are compressed solid dosage forms that contain the active drug, along with excipients that help with stability, absorption, and ease of administration. They are designed to deliver the drug efficiently into the body, easy to carry and store, and ensures accuracy in drug administration. Many tablets are also coated. This coating can protect the drug from the acidic environment of the stomach, prevent degradation, or allow the drug to be released slowly over time through controlled release mechanisms. Because of their convenience, stability, and precise dosing, tablets remain one of the most popular dosage forms in modern medicine. Some common examples include aspirin, which is used as a pain reliever and blood thinner, and paracetamol, a widely used medication for reducing fever and relieving pain. Next one is capsules. Ever wondered why some medicines come in capsules instead of tablets? Capsules are a widely used drug form, offering easy swallowing, better absorption, and protection for sensitive drugs. Capsules are drug formulations enclosed in a shell made of gelatin or a vegetable-based material. They are designed for easier ingestion and enhanced drug delivery. Capsules can be classified into two main types. Hard capsules have a rigid shell and typically contain powders, granules, or beads. A common example is amoxicillin capsules, which are widely used to treat bacterial infections. Soft gel capsules, or soft gels, have a flexible shell and usually contain liquid or oil-based medications. An example is vitamin E soft gels, which help improve nutrient absorption. The next solid dosage forms are powders and granules. When it comes to quick and efficient drug delivery, powders and granules are among the most effective dosage forms, whether for oral inhalation or topical use. These finely divided solids offer rapid absorption and are used in various healthcare applications. Powders and granules are both finely divided solid drug forms, but they differ in key ways. In the case of powders, they consist of very fine particles, often mixed with excipients for easy administration. But in the case of granules, these are larger particles than powders, which are usually bound together into small, uniform aggregates. Powders and granules dissolve more quickly than tablets and capsules, leading to faster drug action. Let's look at some common examples. Oral rehydration salts are a powder used to rehydrate patients with dehydration caused by diarrhea or vomiting. Antibiotic powders are used for reconstituting liquid medications to treat infections. Another one is effervescent granules. These granules dissolve quickly in water, releasing carbon dioxide and making them an effective way to deliver medications such as aspirin or vitamin C. Next is suppositories. Suppositories are solid forms of medication designed to be inserted into the rectum, vagina, or urethra, where they melt at body temperature for effective absorption. Suppositories offer several advantages, such as bypassing the digestive system. This is particularly helpful for people who have difficulty swallowing or suffer from conditions that affect the stomach or intestines. Another advantage is fast absorption. The drugs in suppositories are rapidly absorbed, providing quicker relief for conditions like fever or constipation. Here are some common examples of suppositories. Glycerin suppositories are often used to relieve constipation by stimulating bowel movements. Paracetamol suppositories used for fever reduction, especially in children who cannot take oral medication. The next category is transdermal patches. Transdermal patches are small adhesive patches that are applied to the skin. These patches contain a drug embedded in a solid polymer matrix, allowing the medication to be absorbed through the skin into the bloodstream over time. Once the patch is applied, the drug slowly diffuses through the skin layers and enters the bloodstream. This continuous delivery system helps maintain stable drug levels in the body without the peaks and troughs that can occur with oral medications. Advantages are: they're convenient and effective. The patch delivers a controlled, steady amount of medication over time. For example, nicotine patches. These patches are used to help individuals quit smoking by delivering a steady, controlled dose of nicotine throughout the day. Then, fentanyl patches are used for pain management. Now moving to lyophilized powders. These are another kind of solid dosage form. Lyophilized powders are also known as freeze-dried powders. Some drugs are chemically unstable when in liquid form and may lose their effectiveness over time. Freeze-drying helps preserve the drug's potency by removing moisture, which can degrade it. This process ensures that the medication remains stable and effective even when stored for long periods. Once reconstituted, the drug is ready for injection or other types of administration. For example, penicillin injection. Penicillin, a widely used antibiotic, is often found as a lyophilized powder, ensuring its stability and potency before use. Another example is vaccines. Many vaccines, including those for hepatitis B or influenza. The next one is implants. An implant is a slow-release, solid dosage form that's placed under the skin to deliver drugs. Gradually, over an extended period, implants offer several key advantages, such as long-term drug release, ease of use, and maintenance of steady drug levels in the blood. For example, hormonal implants offer contraception. These implants release hormones like progesterone over time to prevent pregnancy. Another example is insulin implants. In some cases, insulin implants are used for diabetes patients to maintain steady blood sugar levels without the need for daily injections. Now let's talk about liquid dosage forms. Liquid drugs are medications in liquid form, meaning they are dissolved in a solvent, usually water or another liquid. They offer faster absorption compared to solid forms. They are also ideal for patients who have difficulty swallowing pills, such as children, the elderly, or those with dysphagia. Additionally, liquid medications allow for easy dose adjustments, which is especially important for patients who may need a higher or lower dose, depending on their condition or age. Now, let's see what the different kinds of liquid dosage forms are. The first one is aqueous solutions. So these are drugs dissolved in water or water-based solvents. Aqueous solutions are the most common liquid drug formulations because water is an excellent solvent for many medications. Common examples include cough syrups, used to relieve coughs and colds, and eye drops, which help treat dry eyes and eye infections. Next, we have alcoholic solutions, where drugs are dissolved in alcohol or hydroalcoholic solvents. These solutions are often used when the drug needs to be more concentrated or when it's more soluble in alcohol than water. For example, elixirs like antihistamine elixirs, which help to treat allergies, and tinctures such as iodine tincture, used for its antiseptic properties. The next one is emulsion. An emulsion is a mixture of two liquids that don't usually mix, like oil and water. To stabilize this blend, an emulsifying agent is added. This agent helps keep the oil and water from separating, creating a smooth, uniform mixture. Emulsions are often used for drugs that are insoluble in water. For example, cod liver oil is rich in omega-3 fatty acids and vitamin D. Milk of magnesia is used as an antacid and laxative to relieve indigestion and constipation. The next one is suspensions. Suspension is a liquid dosage form in which solid drug particles are dispersed throughout a liquid medium. These particles are not dissolved. Instead, they float or suspend in the liquid. However, since they are not dissolved, the suspension needs to be shaken before use to ensure the drug particles are evenly distributed and provide the correct dosage. For example, an antibiotic suspension, such as amoxicillin, is commonly used to treat bacterial infections. Another example is antacid suspensions, like those used to neutralize stomach acid and relieve indigestion. The next one is injectable solutions. Injectable solutions are sterile liquid formulations designed for administration via syringe or infusion. These solutions are typically used for intravenous, intramuscular, or subcutaneous injection. Unlike other forms of medication, injectable solutions are delivered directly into the bloodstream or tissues, ensuring rapid absorption and quick therapeutic effects. For example, insulin injections are used to manage blood sugar levels in people with diabetes. Vaccines, such as the flu vaccine, are administered intramuscularly to protect against diseases. Saline infusions are used to hydrate patients and restore electrolytes. Next one is volatile liquid. Volatile liquids are drugs that vaporize easily at room temperature, allowing them to be inhaled into the respiratory system. These drugs are typically delivered through specialized equipment like nebulizers or anesthesia machines, where the liquid is transformed into a vapor or gas, which can then be inhaled by the patient. Once inhaled, the drug quickly reaches the lungs, providing rapid therapeutic effects. Volatile liquids offer several advantages, such as rapid action and precise dose control. Examples of volatile liquids include anesthetic agents and nebulized bronchodilators. Anesthetic agents, such as isoflurane and sevoflurane, are commonly used in general anesthesia to induce unconsciousness during surgery. In case of nebulized bronchodilators, drugs such as albuterol or salbutamol, used to treat respiratory conditions like asthma and chronic obstructive pulmonary disease. The next one is oils and oleaginous solutions. Oils and oleaginous solutions are liquid drug formulations where the active drug is dissolved in an oily medium. These oils can be natural, like vegetable oils, or more specialized oils, such as castor oil. The drug in these solutions is released slowly over time, which makes this formulation especially useful for conditions requiring long-lasting effects or steady drug delivery. For example, vitamin A and D oil-based preparations. These are often used for deficiency and are absorbed slowly to provide a sustained release of vitamins. Next is castor oil, known for its laxative properties. Castor oil is a classic example of an oleaginous solution that works over time to release constipation. Now we are moving on to gases used in pharmacology that exist in the gaseous state at room temperature. These gases are administered by inhalation and are absorbed quickly into the bloodstream through the lungs. Their rapid absorption and quick effects make them ideal for certain types of treatment. Gaseous drugs offer several important advantages in medical treatment. They are rapidly absorbed through the lungs, producing almost immediate effects. Administration is non-invasive, as patients simply inhale the gas rather than receiving injections. Healthcare professionals can precisely control the dose by adjusting the concentration of the gas being delivered. In addition, these drugs are quickly eliminated through respiration, reducing the risk of drug accumulation in the body. There are different kinds of gaseous dosage forms. The first one is anesthetic gases. These are used primarily during surgeries to induce and maintain anesthesia. The most common example is nitrous oxide, which is also known as laughing gas. It has both anesthetic and analgesic properties. The next one is therapeutic gases. These are used to treat various medical conditions. particularly those involving respiratory issues. Oxygen is the most common therapeutic gas, helping patients with low blood oxygen levels to breathe more easily. Another example is the helium-oxygen mixture, which is often used to treat conditions like asthma or chronic obstructive pulmonary disease, as it allows for easier breathing. Finally, we have diagnostic gases. For example, xenon. For instance, it is used in imaging studies to help evaluate organ function, such as in brain scans or pulmonary function tests. Now, let's discuss the major categories, such as the biological nature of drugs. Drugs are not just chemicals. They interact with our body's biological systems in different ways. Understanding their biological nature helps us to determine how they work their sources, metabolism, and therapeutic applications. Drugs interact with biological systems in three main ways. The first one is an agonist. These are the activators, the drugs that activate receptors in our body, mimicking natural compounds to produce a physiological response. For example, morphine binds to opioid receptors and reduces pain by mimicking endorphins. The next one is the antagonists. These are the blockers. These drugs work by blocking receptors, preventing a biological response. For example, naloxone competes with opioids at receptors, reversing overdoses in an emergency. Next are enzyme inhibitors, the blockers of reactions. Certain drugs work by stopping unwanted chemical reactions in the body. For example, aspirin inhibits COX enzymes and reduces pain and inflammation. Now, moving on to the pharmacological nature of drugs. The pharmacological nature of a drug refers to its chemical properties, mechanism of action, interactions with biological systems, and therapeutic or adverse effects. Understanding these properties is essential for choosing the right drug, ensuring safety and predicting side effects or interactions with other medications. So under this, we have several categories. The first one is based on the chemical properties of drugs. The chemical properties of a drug determine its stability, solubility, and how well it can be absorbed and distributed in the body. Based on chemical nature, drugs can be classified into different groups. For example, alkaloids such as morphine and quinine. These are naturally occurring and nitrogen-containing compounds. Another one is glycosides such as digoxin. These are sugar-bound molecules often derived from plants. Next is based on the mechanism of action. The mechanism of action explains how a drug interacts with its targets in the body to bring about a therapeutic effect. For example, calcium channel blockers. These are ion channel modulators. Amlodipine is a calcium channel blocker that relaxes blood vessels and lowers blood pressure. Next is based on pharmacokinetics. Pharmacokinetics explains what happens to a drug once it enters your body. It consists of four main processes: absorption, distribution, metabolism, and excretion. Commonly remembered as ADME, absorption explains how the drug enters the bloodstream, such as via oral, IV, or IM routes. Next is distribution. It explains how the drug spreads to tissues and organs. Metabolism explains how the liver or enzymes break down the drug, and excretion describes how the drug leaves the body, such as through the kidneys, liver, or lungs. Moving to pharmacodynamics. Pharmacodynamics is the study of a drug's effects on the body, while pharmacokinetics is the study of what the body does to the drug. Several factors influence how a drug produces its effects. The dose-response relationship means that the drug's effect generally increases with dose. The therapeutic window represents the safe range between the effective and toxic doses. Potency and efficacy describe how strong a drug is and how effectively it produces its desired effect. For example, aspirin relieves pain at low doses, while higher doses can reduce inflammation. Next is based on therapeutic and adverse effects. Every drug has a desired therapeutic effect, but some also have unintended side effects. Understanding both is important for safe drug use. So let's see what the different types of effects are. The first one is the therapeutic effects. These are the intended benefits, such as pain relief from ibuprofen. Adverse effects are unwanted side effects, such as drowsiness from antihistamines, Moving to toxicity. These are the harmful effects due to overdose. For example, liver damage from excess paracetamol. The next effect is drug interactions. These are unintended effects when multiple drugs are taken together. Using ibuprofen with warfarin may reduce the effectiveness of warfarin in preventing blood clots, putting you at risk. Now, let's move on to another major classification that is solubility-based. Drugs can be categorized based on their ability to dissolve in different solvents. Solubility plays a crucial role in drug absorption, distribution, metabolism, and elimination. So here we have two categories: water-soluble and lipid-soluble drugs. Water-soluble drugs are also called as hydrophilic drugs. These drugs dissolve easily in water and circulate freely in the bloodstream. They are typically excreted through urine, making them suitable for short-term effects. For example, paracetamol. These are quickly dissolved and provide fever relief. Another example is penicillin. This can be easily distributed in the body and excreted via the kidneys. The next classification is lipid-soluble drugs, or lipophilic drugs. These drugs dissolve in fats and oils, allowing them to cross cell membranes easily. They often accumulate in fatty tissues, leading to a longer duration of action. For example, diazepam, which dissolves in fats, crosses the brain barrier and acts as a sedative. Another example is steroids, which readily penetrate cells, making them effective for their anti-inflammatory effects. Now we are moving on to a size-based nature. Size always matters when it comes to drugs. Their molecular size determines how they interact with the body. Drugs can be classified by molecular size, which influences their absorption, distribution, metabolism, and elimination. Most drugs fall within the range of 100 to 1,000 Daltons, allowing them to bind specifically to their target receptors. Based on their size, drugs exhibit different properties and mechanisms of action. Under this first category is nanomedicine, the molecules with a size of 1 to 100 nanometers. These engineered drug particles enhance bioavailability and provide targeted drug delivery. These are used in cancer therapy, imaging, and controlled drug release. For example, gold nanoparticles, which are used in drug delivery systems. The next category is molecules with a size of less than 100 Daltons. These are extremely small. Extremely small drugs lack features like shape, size, configuration, or chirality. They can be easily diffused across biological membranes without the need for transporters. For example, lithium has a size of 7 Daltons. These are used in mood stabilization. Another example is ammonia, with a mass of 18 Daltons, which plays a role in biological metabolism. Moving to the next category, standard drug molecules. That is, molecules with a size between 100 and 1,000 Daltons. Most pharmaceutical drugs fall within this range. These molecules are small enough to cross membranes, but large enough to bind selectively to receptors. For example, aspirin has a molecular weight of about 180 Daltons. These are used as a pain reliever. Another example is morphine, with a molecular size of about 285 Dalton, and which is used for pain management. The next classification contains larger molecules with molecular weights greater than 1,000 Daltons. While most drugs fall within 1 to 2,000 Daltons, some biological drugs exceed this range. These macromolecules cannot easily diffuse into cells or tissues, requiring specialized delivery methods due to limited membrane permeability and poor oral bioavailability. This can be administered via injections. Examples of large molecule drugs include insulin and vaccine insulin, with a molecular weight of nearly 5,800 Daltons, which are used to regulate blood sugar levels and are given via injection. Vaccines such as mRNA vaccines have a molecular weight of nearly 4,000 Daltons and are used to stimulate an immune response. Now we are moving on to the final major category, source-based nature. Drugs can be classified by their origin, whether they come from plants, animals, microbes, laboratories, or biotechnology. So the first category is natural drugs. These are derived from nature, such as plants, animals, or microorganisms, and these drugs have been used for centuries. Examples for plant-derived drugs are morphine, which is obtained from the opium poppy and is used for pain relief. Quinine is obtained from cinchona bark and used to treat malaria. Next, the animal-derived drugs. Examples of animal-derived drugs are heparin and captopril. Heparin is extracted from pig intestines and used as a blood thinner, and captopril is derived from snake venom and used to lower blood pressure. The next category is microbial-based drugs. Examples are penicillin and streptomycin. Penicillin is obtained from Penicillium molds and used as an antibiotic. Streptomycin. It is obtained from Streptomyces bacteria and used to treat tuberculosis. The next category is synthetic drugs. They are designed and produced in labs, and synthetic drugs ensure purity, stability, and efficiency. Under this, we have fully synthetic and semi-synthetic drugs. Fully synthetic drugs are completely designed in labs, for example, aspirin and diazepam. Aspirin is used for pain relief and its anti-inflammatory effect, and diazepam is a lab-made pencil. Diazepam is used as an anti-anxiety medication. Next are semi-synthetic drugs. These are modified natural compounds. For example, heroin and amoxicillin. Heroin is a modified product of morphine, and amoxicillin is a modified penicillin with improved properties. The next one is biotechnological drugs. These modern medicines were developed using genetic engineering or recombinant DNA technology. For example, recombinant human insulin and mRNA vaccine. Recombinant human insulin is produced using genetically engineered bacteria for the treatment of diabetes. mRNA vaccines like COVID-19 vaccines are designed to train the immune system. The next category is mineral and inorganic drugs. Unlike plant or animal-derived medicines, mineral and inorganic drugs are obtained from naturally occurring mineral sources or inorganic chemical compounds. These drugs are often stable and effective, and they play important roles in various medical treatments. Examples of mineral and inorganic drugs include lithium carbonate and magnesium sulfate. Lithium carbonate is used in the treatment of bipolar disorder, helping to stabilize mood and reduce episodes of mania. Magnesium sulfate is used to treat seizures associated with eclampsia, manage magnesium deficiency, and in certain conditions such as severe asthma. Okay, friends, that wraps up our discussion on the fascinating nature of drugs. Today, we explored the physical, chemical, biological, pharmacological, solubility-based, size-based, and source-based classifications of drugs, each of which plays a crucial role in drug action and development. We learned that a drug's chemical structure and biological interactions determine how it acts within the body. Similarly, solubility and molecular size play important roles in absorption, distribution, metabolism, and elimination. Whether natural, synthetic, or biotechnological, drugs have a significant impact on shaping modern medicine and improving healthcare. Understanding the nature of drugs helps us appreciate how different drug properties influence their effectiveness, safety, and therapeutic outcomes. Thank you for joining this lesson and exploring this important foundation in pharmacology. Make sure to like, share, and subscribe to stay updated.